Good evening. We are here today in Bonsa. It's a community around Kachuma in the Gambia. I'm here today with Mr. Emily, who is our host here today in this community clinic. As you can see behind me, it's BACE. We're very happy to be here today. And also understand they're also a charity-based organization that are into serving the community through health. We're here today to supply them with medical items, mobility items that were collected in the UK through our partners, Wheels to Heal. You can see their banners behind me here. We are so grateful to all our volunteers, our partners, Wheels to Heal as well, for doing the collection in the UK. You know, it's very difficult in the cold, running around collecting items. We are so grateful for all those who have taken part in this activity to make this a success.
You are welcome to our facility. Basically, we're serving about 8 communities. Okay. Yeah, we do basic services like consultation, that is basically outpatient. And then we have a delivery services here, that's the labor, and also RCH. It's a small facility with 3 staffs. 3 staff, huh? Yeah. Basically, and the auxiliary staff are also 2. We have a night watchman and an orderly. Okay. Yeah, 1 orderly, 1 night watchman with 3 staff. I believe we can go in and take a small tour of the facility. And this basically the facility. We have 1 consultation room, 1 observation room, 1 dressing room, and the pharmacy, and then the labor ward. So I think we start with the labor ward. Yeah, so this is the labor ward. This is where we consult the pregnant women and also those who come in for labor. We see them here. Actually, we don't have standard delivery beds. This is where we put our wipers, pads, and then clothing for the kids. Like when women give birth, we give them pads, we give them wipers, we give them sometimes shampoo, and also give them clothing for the kids.
So is this for sale?
No, it's free. It's a charity organization actually, and the name of the charity is BACE. So it's building and assisting communities with education.
Oh, sure.
Yeah, so basically we have a nursery school, that's where you met me. It started with the nursery school, then we inculcated health into it, and this is our 11th year.
Wow.
We don't have standard delivery beds actually, but this is where we do the labels. Basically, we use this one most because it is the one that is
more comfortable.
Yeah, more comfortable because it is basically waterproof. Yeah, but you can see now it started going off. So I usually stitch it.
I'm seeing here.
Yeah, you can see stitches. Yeah. So, but we don't have a standard delivery bed. This is basically a sterilizer, which we are not because we need to use it, I think, with gas or whatsoever. Yeah, so I'm trying to see if we can get an electric sterilizer so that we just fix it and then use it rather than this one.
This one is difficult to use. This one, yeah.
It's difficult to use, yeah. So
right now, how do you sterilize?
Right now, what we do is we use we wash it with bleach. Yeah. From there, I use spirit, and then I do dry them under the hot sun. Yeah, so. And this is our dressing room. This is where we do the dressings. This is what we call the postnatal observation room. When we have patients that we need to observe, we keep them here. Well, as you can see, maybe the beds that you brought will come in handy here. We can put in another extra bed here to have 3 beds. So when the clinic is busy, when we have a lot of patients, we also use here for consultation. Yeah, this is where you can see the test kits, the BP machine, and so on. So those who need admission, we refer them to Brikama. Our ambulance had a breakdown. It has a breakdown, so we are working on another ambulance. But as of now, when we have a referral, one thing we do is we call Gunjur. They have a community ambulance there. So the community ambulance comes. When it comes, we take the patients to Brikama.
How do you manage the bills for that? Because
Regional director was here about a month or 2 back. They usually come here time to time on supervision. So they are
aware.
They are aware. This is where we put all our drugs.
Where do you go for supplies?
We buy it.
You buy them?
We buy our drugs. Yeah, they send in money from UK, and then we go and buy. So when the money comes, we go and buy drugs. The only drugs we get from the ministry are these ones. This is malarial drugs, and also the FP services, family planning services. Yeah. Those are the different doses. Family planning and malarial drugs are the ones we get from the government.
Paracetamols?
We buy them.
Buy them.
Yeah, everything, anything that needs dressing materials, paracetamols, and all the other stuffs, we buy them.
Do you guys sell these medications?
Yeah, they pay, adults usually pay $75,
okay,
and kids will pay $50.
But when you pay that, that's like the ticket, so whatever medicine
you only need to pay the ticket $75 an adult, and then kids $50 each, and then we give you treatment.
All the medicine that you need?
Yeah, all the medicine. Unless anyone that's not available, then you can
go and buy
it outside.
So let's say if you're talking about budget-wise, monthly, how many patients do you see, and how much you guys spend on medication?
We buy per 3 months.
Perfect, for 3 months.
When the clinic is busy, sometimes we see more than 600 patients in a month.
In a month?
Yeah. Especially during the rainy season, we see a lot of patients.
Of course, yeah.
So when the drugs are available, you see people coming. And when the drugs are not available, you see the rate goes down.
When we talk about your stock for 3 months, how much does that cost you, roughly?
Okay, roughly, when I went for a survey, when I did my budget for the 3 months, it's like it went up to 98,000. 98,000. Now we are buying at 60,000.
Okay.
For 3 months, we buy 60,000. We manage with the drugs, because if you look at it, that 60,000 cannot take us for 3 months. But we try to manage. So when it is finished, we ask them and they send in another one. Yeah. This is where we keep the drugs, and then we supply this cupboard. As you can see, it's kind of empty, and then the person dispensing sits right there.
Sits there, okay.
When ladies give birth, we give them stuff. They're in these cartons, so you can see everything is. We put it in bags. Then after we add in the extra things like parts and all that stuff. So
yeah, it's good to know this. So at least now we have baby clothes, we know where they could be more useful.
Yeah. We are also working on laboratory materials. We already did the purchasing, the materials are yet to come, and we need to work on here also. This place, we created it for a laboratory.
Yeah, it makes sense.
This was part of the pharmacy. We just built a wall and then created this room for laboratory.
We're here today to distribute some chairs, some hospital beds, some wheelchairs, some gloves, and we hope this will definitely help this facility. And we have gone around the facility to see what they are doing. They are doing so great to help the community here, free of charge, you know. And we all know healthcare is expensive. It takes a lot of effort, sacrifice, you know, to run a healthcare. You know, the staff themselves risking their lives with little or no available resources, you know, to support the people that are in this community. So for that being the case, we are so grateful, saying thank you for all your sacrifice, thank you for your support, and know that from today you also have met other partners. Sure. We're very happy to work with you in this course, because without health, nothing is possible. Health is a key, and I believe as partners in development, we all have different strengths. So if we all come together, we will definitely succeed. So we are so happy to be here today, and we always keep this place in mind. Whatever we can do to support this facility, we'll definitely be here to support. And this is just an official, they say I should do a handing over. So this is a glove in a pack. Yeah. So this is to say thank you so much for having us.
You're welcome.
Yeah, thank you.
And I think we should be saying a big thanks to you people. These materials that you've given us will come in. They'll go a long way in serving the communities over here. We're really grateful, and we are appreciative of your efforts to even reach us alone. It's something that is wonderful and great. We are grateful, and we thank you, and we promise that we'll keep on doing the good work and surely we'll work together to make the Gambia a better place.
Thank you very much. Thank you. Thank you so much, guys, for all your efforts and your sacrifice. Yeah.
Okay.